The Palestinian Red Crescent Society is saying patients at that hospital, Al-Quds, include incubated newborns. Health care for those very young, as well as for some of the 50,000 pregnant women in Gaza, is becoming more and more difficult. The UN estimates more than 160 women are giving birth every day. Abby Kugathasan has the details from London.
Heather, like everyone else in Gaza, they're worried about Israel's ongoing aerial bombardment. So food, water, and shelter, absolutely the prime concern. But none of that is guaranteed right now. And if you're pregnant in the enclave, as more than 50,000 women are, it's exceptionally difficult. I just got off a Zoom call with Zoraida Hussein Saba. She's in the West Bank, and she's with ActionAid, which is a global NGO that operates in the Gaza Strip. She's been talking to her colleagues there, and she outlined the challenges for me. She said that there's a lack of food and water, which means the mother-to-be isn't getting the nutrients that she needs. And if they do have anything, they're going to feed the children in the family first. She also said that women who are pregnant for the very first time have more questions and concerns, but find themselves in a war zone where that expertise is just simply not available to them. She also spoke about overcrowded hospitals and the issue that that poses to a pregnant woman who might be going into labor. Let's have a listen.
The priority in the hospital is those who are very badly injured. So she might give the birth, and then they will ask her to leave the hospital immediately for her safety, one second, because they need a place. So she cannot assure that she will be in a good place and resting after she gives the birth.
Now, another worry when hospitals are at capacity or beyond capacity and healthcare workers are struggling to cope, minor delivery complications can become life-threatening ones. And the threat of waterborne diseases as people drink unclean water out of sheer desperation is now top of mind, according to a UN representative with the Relief and Works Agency. Heather.
You mentioned that there are a number of other concerns, multiple concerns for women in Gaza, and I'm wondering about another of those, Abby. How are they able to take care of their menstrual health?
Well, certainly this is something that we talk about often here in the West. It's an inconvenience at best, in the best of circumstances. But in Gaza, it's painful without medication, it's uncomfortable without period products, and it's possibly a health risk without access to clean water and clean and secure sanitation facilities. Some people have spoken about waiting for hours to access a usable toilet. Again, shortage of medicine and sanitary pads, a major concern. Ms. Hussein says that she knows of one family in Gaza where the women are using babies' clothes as pads and then burning them after use. She also said some women are missing their periods in Gaza entirely, which is likely caused by the extreme stress that they've been experiencing. But again, there's not enough water to shower or bathe or clean themselves, and unwashed clothes or other items that they're using because they have to may cause infections like hepatitis B and thrush.
Abby Kugathasan in London this morning.